This is Patrick Houston. I'm thrilled to welcome all of you to our very first AI cohort session. This one is on healthcare AI, which not only impacts all of us as humans, but it also raises some really interesting privacy and ethical issues, which we're going to get into here. I want to thank our sponsor, Foley, and with that, turn it over to one of their partners, Louis. Over to you, Louis.
Thank you so much, Patrick, and welcome everybody. I'm Louis Lowe. I'm a partner at Foley & Lardner in Silicon Valley, and I help the companies get formed, financed, scaled for growth, bought and sold. And really delighted to be a part of this community, and thank Lisa and Patrick and Kate and the whole team for bringing us together. We spent a lot of time trying to think about topics that are both engaging and relevant to our community. And obviously, you can't go anywhere without hearing about generative artificial intelligence. And today, we wanted to really dial that topic into your responsibilities as directors. And what's really unique about the United States healthcare system is that it is directly tied in 90% of cases to an employee's employer. And so you as directors, in fact, are stewards of our healthcare system. Yes, you are. Pretty shocking revelation when you think about it. And the way that healthcare is delivered, the way healthcare is serviced, the way it's paid for, really every aspect of healthcare is being disrupted and needs to be disrupted, rendered more efficient and more cost effective. And I couldn't think of a better group of people to describe this than the folks here today. So I'm going to ask my friends and co-panelists, Timothy, Dee, Walter, and Rajeev, to give us the 15 seconds on themselves and maybe one thing they'd like each of you to take away from this talk today. And I'm going to start with Timothy Chou. Timothy? And you've got to unmute, sir.
There we go. Louis caught me off guard. I didn't know I got to be first. Anyway, quick introduction. Long time Silicon Valley person, came to work at Tandem Computers, one of the original startups in the Valley. Have served on public company boards for the past 23 years. More recently, after I left, retired from Oracle, running their cloud computing business, I started up a class in cloud computing at Stanford, inspired by one of my students. About 3 years ago, came out of retirement, formed a company with a mission to reduce healthcare inequity, lower cost, improve patient outcomes by creating privacy-preserving, real-time applications based on access to data in all 1 million healthcare machines in all 500 children's hospitals in the world. We call it the pediatric moonshot, and have been making amazing progress in it over the past several years. Glad to talk about that more. If I was to say what people should take away, you touched on it, Louis. I think as board members, healthcare cost is the most significant non-compensation cost. And I think if we were to focus on how are we going to deliver AI in medicine, we could indeed reduce cost and improve quality for our constituents, for our employees, which leads to the last piece, which is some of you are involved in ESG, the S in ESG, societal. There are a number of companies who are investing in societal healthcare. And I think for those of you who are in that category or of interest in that as board members, I think, again, AI software technology has the capacity to deliver big changes in societal healthcare.
Thank you, Timothy. Dee, you've got to unmute in the 15 seconds on you and Sourcero, and I'm so glad you made it today.
Thank you, Louis. I'm happy to be here. My name is Dipanwita. I am the CEO and co-founder of Sourcero, and we're an analytics platform that supports better patient access to treatments that are already in market. And we, of course, use a bunch of AI to do that. And the way we do it is we make the information around that treatment, the patient populations it can impact, and also feedback from the field on how the treatment is working, more accessible and more transparent, so that patients can advocate for the treatments that work for them, so that doctors know how to use them, regulators know why they should pay for them at all, and also the manufacturer themselves have a better handle on creating the information that backs their treatment. So this is a huge data initiative here that we support. And the reason we're excited about that is because AI has unlocked our ability to really handle data at scale. And that's really one of the best applications of AI that actually works and is production grade and in the market is in healthcare and life sciences. And we see that is very, very valuable because as board directors, as an employer myself, I am responsible for my constituents' healthcare. The thing I am most excited about is, can my constituents and can I advocate for the best care for myself because I understand the treatments there better than I was able to before. And I think both generative AI and otherwise, AI really offers us an opportunity to understand better the science that backs the treatments that will save our lives.
Thank you, Dee. Thank you so much. Great representation from a startup in the community that's really working with this technology to change outcomes. Walter, you did the same thing with a company called Doc.ai a few years ago, and now you're the chief scientific officer at a large public company called ShareCare. Tell us about yourself and what you hope our audience can take away from your talk today.
Yeah, can you hear me?
Perfect.
Yeah, all right. Yeah, well, I spent like 10 years in healthcare now. And I think with what's happening now with large language models and agents is really a new hope on the horizon. I already given up actually with healthcare, but now it all comes back. And so I am a professor at Stanford and the course director of 205. I just got all my courses will now about AI. So it's really, reaching a critical level in society, I believe, especially in academia. And so I'm also part of the team that sets up TED AI, the new TED conference in San Francisco, where, the creme de la creme of AI is coming to talk. So I believe it's going to be a hot couple of years for AI, where it will recursively improve upon itself. And yeah, I'm all optimistic.
Thank you, Walter. And for everyone in the audience, that's October 17th at the Herbst Theater in San Francisco, day one, and at Shack 15 in San Francisco on day two on October the 18th. Rajeev, you wrote a book, AI and You. You ran healthcare at Deloitte. You ran the digital automation group at Anthem, which I think it's changed its name, but one of the largest insurers in the world. And now you're at Lyric. Tell us about yourself and what you hope directors will take away from your talk today.
Yeah, thanks, Louis, and thanks for having me. First of all, a pleasure to be here with this esteemed group, and thanks to the NACD for hosting us. Yeah, so Lyric's, sort of in the business of simplifying healthcare. So while Timothy and Dipanwita talked about care itself, there's a whole ecosystem of work that needs to happen in our country around how then the care, the business part of it gets settled, the financials settled between the consumers, the payers, and the care delivery providers. And so Lyric sort of sits at that unique nexus to simplify that using AI and other technologies, if you will. As for my introduction, I've been working in AI for the last 20 plus years. I've been through a few winters of AI and a few springs, and now the summer of AI, if you will. And so optimistic about what we could achieve together with the technology. And I think for the directors, my view is simply this: that in the next 10 years, the only companies that'll thrive are the companies that'll figure out how to use AI. And anyone that chooses to ignore it, will no longer exist. I think it's not hyperbole. I think it's based in the reality of how fast the technology is changing and how much potential it offers, both to go create new growth opportunities as well as to play defense and protect the existing markets. So I think as directors, it's then I think our responsibility to steward the companies effectively in the use of this technology, help the companies curate the right talent, and of course put the ethical, responsible, explainable sort of practices in place so that any unintended sort of consequences of this technology could be minimized, and that we're proactively shaping governance and governance committees to make sure that we're complementing management teams in stewarding this technology appropriately.
Thank you, Rajeev. And interestingly, I think you're one of the panelists who have taken a lot of time advising boards of directors on how to integrate AI into their business practices. But today we're just going to talk about how AI is going to impact healthcare. And I wanted to give you a chance, because you've got a chapter in your book about this, to share with the audience about the state of automating the U.S. healthcare system today.
Yeah, so thanks, Louis. And the book is You and AI, the puzzling together the future of healthcare with AI, blockchain, and exponential technologies. And really, what I wanted to lay out was, what the business problems are with healthcare in the U.S. Not the least of which have to do with misaligned incentives between, what we reimburse for and then how care gets delivered, and how perhaps we can use exponential technologies like AI to address that problem. But specifically around automation, we've all heard about this notion of $1 trillion of waste in the system, and that has to do with once care gets delivered, i.e., if Louis or any of us here were to have a medical procedure done, the events that follow are complex and time-consuming and laborious. In some cases, the procedure that one might require might need a prior authorization. If once the procedure is done, then there's a complex process of actually codifying what did happen, and then putting all that together and submitting that to the payment authorities or the payment bodies to get reimbursed. And once reimbursed, there's a whole nother process that verifies that the payment was actually made accurately. And then if it's not, then it's recovered in some cases. There's also maybe multiple parties involved as to who's responsible for the payment, and that's called coordination of benefits. You put it all together, none of those processes are designed to help the consumer, nor the care provider, nor provide any significant value to the payer, other than just to minimize the instances of fraud, waste, and abuse in the system. And as a result, the majority of the system that's actually acting in good faith gets penalized because of a few bad actors. And all said and done, that's creating $1 trillion of waste. So what I hypothesize in the book, as well as have spent the last 5 years at my previous employer at Elevance Health doing, was really looking at each process that runs between care delivery and payers, as well as the broader ecosystem with drug manufacturers and what have you, PBMs, and say, well, how could we use all of the history, the billions of transactions that already exist, that have already examined every single procedure and every single payment pattern, to say, well, if it was done this way by millions of others and it was proved to be right, then let's use that, teach our algorithms to pay based on that, and then proactively create the policies and the documentation and the supporting guidelines to make sure that the future transactions can rely on that. So with that, I believe that roughly 50% of all of these administrative transactions could be automated. And in fact, when I was at Elevance, that's the goal we set for ourselves. And as I was leaving and transitioning to this opportunity at Lyric, we were roughly about 60% of the way there in achieving that goal. And I believe that Elevance will achieve that in the next couple of years. And I think if they can do it, I believe that across the system, that gives us hope that it could be achieved at a broader scale.
And for everyone in the audience, Elevance is the new name for Anthem, which is really the congregation of the Blues across the country. It's our largest healthcare provider or insurance carrier in the country. And Rajeev, you and Walter worked on a project which I think is a terrific example that would be helpful for the directors to know about, which I think was called Sydney, where you created an AI bot to automate the process of receiving claims and paying them out. Tell us about that
Yeah.
collaboration and how that reduced healthcare costs.
So in fact, so Walter's company at that time, Doc AI that you mentioned, Louis, was the company that we had partnered with, and we had a keen interest when I joined at Elevance and formerly known as Anthem, to create an ecosystem in which we can leverage the innovation that was happening in the startup community and integrate that into our platform versus having to go invent every new capability ourselves, which would have taken forever and cost us too much. So Doc AI, with Walter's brilliance and the great team, Sam and others that were part of that team, had come up with a few different applications. And one such application, was called Smartomics, which was essentially using all of our genomic data, phenotypic data, and other types of, let's say, core medical information to personalize the information that was presented to our consumers. So Sydney was is Elevance's mobile app, so anyone that's a member of the Anthem Blue Cross Blue Shield plans could download and use Sydney. And some of the AI capabilities within Sydney, which personalize care recommendations based on genomic data and phenotypic data, were the capabilities that were created by Walter and team. And then you could almost essentially keep that as a AI medical diary, if you will, of your symptoms, your reaction to certain drugs, and then contribute that data back to science, if you will, to say, well, alert me when there's a next clinical trial that perhaps matches my profile for the conditions that I have and what have you, and become a super interesting way in which we could engage our consumers on a more continuous basis. Whereas a normal interaction with an insurance company engagement app would be transactional. So you'd come in, pay a bill, check on a status or something, and you'd be done with it. We wanted or rather, when I was there at Elevance, we wanted a way in which we could engage the consumers more continuously, so that then we could promote the use of healthy habits, be more proactive in how care gets delivered, and certainly Walter's company and their capabilities were instrumental in helping us do that.
Rajeev, thank you so much. And I wanted to just give you one last moment to address what you think directors should be asking their management teams about the automation of healthcare in their companies.
So I think it's twofold, Louis. I think it's the automation of administrative processes around healthcare and sort of simplifying that. And two, it's also, I think, providing personalized benefits that are tailored to, based on, let's say, the employees' social equity data. I think Timothy probably will touch on this, based on their medical history, and saying rather than a one-size-fits-all, pick a PPO plan or an HMO plan or what have you, why not personalize the benefits at a more tailored level that incorporate multiple, different factors of health, and some that may be indirectly related to health, such as, social drivers of health, social determinants, and, emotional and, purpose and other things. So I think that would be one, was like, what's the benefit design that drives, productivity and improves well-being? And two, what are we doing to, automate, streamline, and make healthcare more efficient, so that more of the spend on healthcare could be spent on the more productive things of healthcare around, outcomes and well-being.
Thanks, Rajeev. And I want to move over to our entrepreneurs and technologists on the panel, Dipanwita and Walter. Dipanwita and Walter, I'd love for you to share with the directors a little bit about how AI can improve healthcare outcomes for disease prediction, prevention, and treatment. And Dipanwita, maybe I'll start with you, since you're in the thick of it right now with your company, Sourcero. Tell us a little bit, not just about what Sourcero can do, but what AI can do to change outcomes.
Rajeev actually ended at a point that become a big important thing for us to think about. Is all of us are focused on treating the patient, not our patient. We want everything to be personalized, and there is certainly a personalized tailored plan size of it. And we just went through a new plan selection in my company, and let me just tell you, it ended up being quite personalized. But there is also the treatment part of it. And one of the best ways to use AI is to bring together the very, very many data sources and data types that impact a particular person, and then suggest a treatment plan that works for them. And I'll give you a very real life example. One of my relatives has metastatic breast cancer, and they are going to the best cancer center, in one of the best, for their type of cancer. They were put on a drug, and it shot up. It started showing very, very bad outcomes for their liver function. And their care team was about to take them off the drug, which would have, killed them very, very quickly. We were able to then go dig into literature and find exactly 2 pieces of literature that said that for that person with a particular genetic mutation, it is proven that the liver results will look very bad for a while, and then over a month it gets back to normal. So this is what I mean about personalized. It is for that person, and it is for that person's genetic mutation, but it made a huge difference to someone who was looking at another 6 months to be alive versus potentially another 3 years or 5 or whatever. And this person that I'm speaking about has been healthier than they've been for many years previous. And this is really the dream here. One is how do I pay for it and how do I treat them? But on our end, what I'm excited about AI being able to do is to finally orchestrate all of the data that is relevant to the patient and make it easier for their care team to both advocate for and get them that treatment. But that's how we see this, and that's an example of AI and personalized.
Walter, you're at ShareCare, a large public company that is trying to use AI to improve outcomes. Tell us more about the capabilities of the technology to change healthcare outcomes in every way.
Well, the paradox of statistics is that we can actually predict with statistical accuracy, not with mathematical accuracy, but statistical accuracy. If we have like 1 million events, we can predict what is going to happen. But each of these 1 million events are by nature unpredictable. So we have a macro system that works, but a micro system with annoying patients who don't actually, our epidemiology works, but the patients are irreducibly complex. So if now with LLMs, and what is going to come more and more, because we're going to put these, we're now at Stanford already, we have a project where olfactory, smell is going to come into as a sense. We have sight and hearing already, we're going to put more and more of these things into models. If we succeed in seeing why that irreducible complexity does not correspond with the macro view, we make a theory of almost of everything, because the same thing with economics. Macroeconomics works, microeconomics works, but we can't put them together. The same with physics. So now this is, I think, an evolutionary moment for science where we can perhaps put these things together. Will take a while, but you see what I find, and twice a month I talk before boards. There is a speaking agency who has made this formula of 20 minutes talk before the board starts, and then but I find now that these boards are a lot of them have not yet used AIs. When they have used it, although they have nuclear weapons at their disposal, they are using sticks and stones. They're just doing a ChatGPT or search. And so what is now missing is that, and it's very easy, like, first of all, they should not use, when they use OpenAI, they should use the playground, like where a lot more, in 20 minutes, in 10 minutes, you can learn how that playground works. There is an extension on Chrome where you have 5 LLMs, on your screen. You can see what each of them says. And thirdly, there is an agent on Chrome which summarizes all that and where you can brainstorm with. So these are enormous weapons that are still not that are used by a sort of a young generation at the bottom, but not at the top. And that's what we are now trying to propagate. That top, which our audience is part of, they have to understand it a bit more by using it, because this is what Jeff Bezos found out. Writing cultures and trying cultures, muscle memory, they perform better than reviewing cultures or, letting somebody else do the writing or the calculating and just review it. We have to do it ourselves. So leaders have to get in there, do it a little bit ourselves so that we understand it better.
Thanks, Walter. I want to move back to Timothy and Rajeev. So I think Walter mentioned something. Companies are not yet integrating AI in what they do. Who are the key players, Rajeev and Timothy, and where are the opportunities to use AI to interact with those key players in the healthcare system?
You want me to go first?
Go ahead,
Yeah.
Timothy.
Yep.
I figured out the unmute button. So let me start with a comment. I think a lot of people think about this AI as, oh, we're going to replace humans. Now, in the world of pediatric healthcare, just to make a point of it, there are only 500 children's hospitals on the planet. Increasingly, expertise is concentrated there geographically. We only, in the United States, have 3,000 pediatric cardiologists total. We graduate 100 a year. Now, India has 300 pediatric cardiologists for 1 billion population, plus Rwanda has a single pediatric cardiologist. And even if you look at the US, and I, obviously spend time with my friends at Lucille Packard, in the Bay Area, I mean, if you drive to Salinas, which is like, 40 miles from where I'm sitting right now, pediatric cardiology expertise disappears. So it's not really about, replacing a human. There is nobody. There is no expert. We have the opportunity. Now, by the way, my friends over in adult medicine, and let me just make a comment. When I talk about AI, I am actually talking about AI and medical imaging, because there's a tremendous amount of data sitting in ultrasounds, MRIs, CTs, and X-rays. EMR data, in my opinion, is just a bunch of billing data, which is like, okay, fine, I'm glad you're going to look at it. But that's not the real rich data. The real rich data is sitting in the machines, the blood analyzers, the ultrasounds, et cetera. And when you look at that data, you have to then realize, boy, and you can talk to our friends in pediatric cardiology, they actually don't know what a normal ultrasound is, because we've never looked at it that way. And that's from just normal to abnormal question. Let's go over to abnormal for just a second and tell a story. There's a little kid in Florida right now who has a condition called focal cortical dysplasia. He's been MRI imaged like early in life. They looked at it, they said, no big problem. They gave him tons of drugs. Some he qualified for, some he didn't. They were getting ready to put in electrical implants. Now realize during this entire period, he's having seizures 2 to 3 times a day. At night, he wakes up screaming. Finally, they MRI image him again, and they believe, and I could show you the images, not of him, but of this condition, which is a brain lesion. If you can find it, you can actually surgically remove it, and the kid is cured for life. Now, the trick problem there is This only happens 2,500 times a year in the US. So no one clinical neuroradiologist sees enough cases. Now, can AI, and when I particularly talking about AI, is deep learning for image recognition, could it have found it? And the answer is yes, if you can get access to that data. And I could go into how we're doing that and all that. But I think if you want to think about the purpose of what we're doing, it's really to take expertise, which is buried in human brains, that luckily a kid who's geographically or socially lucky gets access to. You know, I work for Facebook and I live in Silicon Valley. Cool, you're covered. Go be a farm worker in Salinas, and yeah, good luck, man. So I just want to make a point. That's really the purpose of AI.
Great example. Thank you so much. And I want to bring that back to our board members. And Rajeev, who are the key players in the healthcare system, and where are the opportunities for directors to insist that AI be part of what's going on to improve outcomes?
Yeah, I think certainly, I think making AI available to in the care delivery ecosystem, I think is going to be key, Louis. And Timothy mentioned sort of imaging and radiology and MRI, and I think absolutely, I think there's a great benefit there. I think there's a diminishing number of pathologists in addition to the diminishing I think supply around pediatric cardiologists. But there are niche fields that people aren't necessarily being going to medical school and being trained on that, where AI can actually do a better job. So I think there's certainly one absolutely great potential to start using it there. But in general, in every case, so primary care physicians, for example, what was the last time that experience was anything memorable? You go in there for 15 minutes, you're out, with nothing more than a cursory checklist of the same questions. How's your health? Are you stressed? Is your family history of any cardiac issues? What have you? And you're out. There's tools out there today that can assist with much more rigorous sort of view into what's happening, what are the factors, and present all that information to primary care physicians, for example, who can then do a better job of triaging, even if they spend the same 15 minutes with you. And I think so that's an avenue to explore. And then there's an AI for every specialist, where I think it makes the practice better. It's not to Timothy's point about replacing anyone as much as it's augmenting, so that everyone that's got humans with with an AI set of assistants that are specialized that could be deployed to make the visit better, make it more 360 in terms of where you can catch, and then track what's happening next, longitudinally, and looping back to make sure that the algorithms are tuned to provide the next best action. That's hugely untapped in the market today. It kind of ebbs and flows because how one makes money on that still is not entirely clear. But I think that's where I think if we keep at it, I think that's where we can make a huge difference.
So, Rajeev, you've sat in many different roles in the healthcare system that interact with the corporation. You were at Deloitte advising companies what to do. You were at Elevance, Anthem, helping them automate, and now you're at Lyric, trying to connect companies to insurance. Who are the key players that are interacting directly with corporations, where directors have the opportunity to supervise, ask questions, make sure that AI is being integrated into what's happening?
Yeah.
Who are those actors?
So within a company, Louis, that it starts with the CEO. I think any company that with a CEO is not directly involved in shaping the AI strategy and its use and monitoring the effectiveness of how the investments are lined up to it, I think again would be doing the company a disservice, and I think it would be upon one of the responsibilities of the board to make sure that the importance is emphasized appropriately. Beyond that,
is the CEO the chief AI officer, or should every CEO have a chief AI officer?
I think the CEO certainly it would be an important enabler of AI. I think just because to localize the efforts and give it, a center of gravity within a company, there's a growing trend to appoint chief AI officers or chief digital officers who have, responsibility for AI. But it's essentially, think of it as a cluster or a cohort, birds of the same feather, that's on the spectrum of digital capabilities, data, AI, ethics. You put all that together. So think of that as the supply side of an enterprise that's creating the capabilities. And then there's the demand side of the enterprise that's got to figure out how to use it, to make the enterprise more efficient, but also be more imaginative in terms of how those capabilities could be used to grow. So, for instance, to Dipanwita's point, right? So if we create more personalized benefits and more tailored, personalized programs around health outcomes, then someone on the business side that owns a P&L, perhaps, around that, needs to figure out, well, how do we price it? How do we sell it? How do we then create net new growth opportunities for the business? So that you can both be focused on top line growth as well as efficiencies. Because just focusing on efficiencies alone, I don't think is sufficient. Because AI has so much potential in terms of all the different things it can contribute. So key roles, I would say, if you're just getting started, pick your chief digital or AI officer. Pick a business unit that has perhaps is underperforming, and say, okay, team, work together, figure out how to make this business unit more efficient, how to make it grow, and give us sort of a scorecard on how we should measure you, and give them a small amount of investment, and give them the flexibility to go experiment and fail fast, and come back with some lessons.
Great blueprint. Great blueprint. Timothy, I wanted to ask you, as a director of several large public companies, where does AI sit in the board? And is it at a committee? Is it at the full board? And I want to credit whoever in the chat gave me this question, but I think directors would like to know whether it's the responsibility of every director to know and monitor and supervise AI, or does it live in a committee?
Yeah, well, I mean, I sit on public company boards that are tech companies, so that skews things a little bit, meaning the companies themselves are thinking about this. So you don't really have to bring it up that much about, well, what is our strategy vis-a-vis large language models or generative AI? I don't think tech companies a little bit easier. I think as soon as you drift out of tech companies, well, this is a subject of a longer conversation. The level of technology expertise on the board, I could even comment about that in tech companies, but when you leave tech companies, it's like de minimis, right? At the board level. Yeah, I mean, we have our friends from audit or whatever on there, but people who actually, can ask the tough tech questions are kind of missing. Some people are building tech committees, subcommittees, advisory groups, et cetera. Let's go hire the smart young kid out of Facebook or whatever. But I think it's a challenge. It's a challenge for the non-tech companies. Have their challenges too. We have plenty of examples where we miss trends, plenty of examples. And I think this wave that, Rajeev, Walter have all talked about, it's morally equivalent. I was there at the beginning of cloud computing. That's now 15, 20 years ago. And those days, everybody walked around going, why would you ever want to do this? Today it's become, just like commonplace conversation, even though many companies are still, very early in their quote usage of cloud computing. I think the usage of large language models, deep learning, et cetera, it's like, we're year one of a 15, 20-year journey, and there will be, casualties from this.
I want to give Dee a chance to double click on that, but just to summarize, I think what I heard you say is that AI lives with every director, and there's no one answer. Each company may have a tech committee or an AI committee, depending on the business needs. And Rajeev's advice: find an underperforming business unit, give them a little budget, give them some focus, and try and integrate AI into one or two functions. So I thought that was really
Louis, let me make it just even more specific. Boards of directors need to get smart about tech, period.
Exactly.
They are not. In general, they are not. Forget responsibility. Yeah.
Dee and Walter, what are those technology innovations that directors need to know about at a high level? And I heard cloud, and that's 15 years ago. I've heard large language models. What are the other technologies? You know, in Rajeev's book, he even talks about blockchain, and I think that was part of Doc AI's business model, Walter. So share with directors what are these technology drivers that they need to know about?
I think it's very easy. They just have to try it out. You know, it's an extension on Chrome, or, you know, I'm not using Microsoft, so I don't know where it is there. But so you have all the LLMs. I spent hours brainstorming with my LLMs. You know, like about mathematics. You know, like. Or about something else. It improves greatly my. I'm so much more productive. I can now watch, you know, half a day Netflix movies for because instead of what I would spend a week, it's now 2 hours. You know, but what I see for 2024 in corporations, and I see the same thing happening. 2024 will be a golden time for cloud. Why? Because there are two factions. It's bring your own cloud, you know, and bring your own API. Like bring your own AI. Sorry. So cloud companies will say, "Hey, don't let your data leave here. We're completely secure. We've been working, for years together. So bring your AI." And we actually have an API already for that AI. Now, on the other hand, AI companies like OpenAI that just launched their enterprise model, they'll say, "Hey, bring your own cloud." So that's going to be, and in 2024, this will be, the great bonuses for people who sell cloud and sell APIs, and then people will use it more. And I believe that also as even as a board director or as an executive, you need your personal LLM node, like your personal node on that cloud, which can be a system which you can brainstorm with, which you can, like put in. If you use the playground, you can just take one report that a division gave you, you put it in the left part of the playground and say, like, "Okay, what do you think of this? Find me the incoherences here, and what are the good questions about it?" And you can brainstorm about it, and you're completely ready for actually understanding, but also arguing about these things. I think it's
So maybe for directors to really understand AI, they have to use it. And I think what I heard you say is create your own account for your own ChatGPT on OpenAI and keep that screen open, because the more you give it context, the more it understands, because it's training. But you've got to keep that account, is it? Or
yeah, well, it's so you see, I treat my my models as students. They forget things. They are whimsical. They make mistakes. They don't summarize well. Not not unlike students are. Like especially undergrads, and so you have to tell them, like, summarize this. You made a mistake again. But I'm very polite, because one day they will rule the world, and then they will go back. If you're
we're going to get to the ethics here soon, but not yet. Dee, tell us, what are the other technology drivers that directors need to know about in terms of implementing AI in healthcare? You're at the cutting edge there at Sourcero. Tell us about that.
First and foremost, consumer AI and ChatGPT is not enterprise AI. It's not one and the same, and should really not be looked at as the way you interact with a chatbot in a low stakes environment where you're asking them to make your travel plans to Italy is not it's not that simple when you actually want to bring it in and integrate in your systems in a secure, compliant environment. So if you're looking at it from a perspective of a director of a board, that what a company is about to implement AI across various functions, I think the first thing is the security of your data. And that is, when our customers come to us and say, hey, we want to apply AI to whatever it is that they want to do, you have to understand where their data is going to live, what is it going to interact with, do we know if it's a black box solution or not, and who's going to interact with the output of that system. And that's the other piece of it. If the person on the other end of the output of the system is not someone who is technologically adept, is not even a digital native or an AI native, they will believe 100% of what it comes out. And that brings in like a big risk there, because we are a lot less forgiving of machine outputs than we are of a human being making a mistake. So you also have to think about reputation. If your company is using a bunch of AI and a bunch of different services, and what that's producing is less than 100%, and your consumers know you're using AI, that does erode trust. We've seen that happen extremely, extremely fast. So that's a second part that I encourage folks to keep in mind. And I think number 3 is, I talk to my board about this all the time, is learning how to ask really important questions about the technology that your companies are implementing. So it's less about knowing it, but actually knowing the right question. What is the risk level of the application? So what is the data it is sitting on? Can you explain the output? Are these compliant? There's a lot of these questions that we train people to ask before they take a decision on yay or nay. And that's been extremely helpful, because you can ask a question whether or not you have, whether or not you understand AI as a concept. So these are some of the things that we have done that has been really useful and very practical and tangible. And we just have to accept that this is a pretty, there is the full range of this is going to take over the world to this is an enemy and I've just turned off my smartphone and I'm going to go hide in a box. So a board does represent and can represent the full spectrum of personalities and thinking. And I think it's really important to find a middle ground to communicate with them around this inevitable technology that one can neither avoid nor should accept wholesale. But yeah, it's my 2 cents.
Thanks, Dee. Coming back to you, Rajeev, you've advised corporations from Deloitte, you've been helping automate payers from the inside, and now you're a conduit to payers at Lyric. What is the opportunity to improve the cost of healthcare in the United States, and what should directors be asking about the integration of AI that's going to improve cost of healthcare? I think that's one of the big blockers to access is cost. And I know my premiums go up astronomically every year. What is the opportunity for directors here to improve costs?
Yeah, I mean that's a pretty broad, system-wide question, I think, Louis. It's just because it's if you look at sort of the bill of goods that ultimately make up the cost, clearly, one line item there is around the administrative processes that are wasteful that we previously touched on. That's an opportunity to automate. And then there's the rightfully so all the medical innovation that happened in our country that ultimately comes at a cost. And so the question is, how do you then make the cost trend more equitable, right? So somehow, somewhere, the cost of caring for chronically ill patients, patients that have complex, comorbid conditions, that cost is escalating every year. Like, so how do we start to address that? And there, I think there are opportunities to use AI to predict what might happen a few months to a few years in advance of things actually happening and manifesting themselves at a point in which you can only maintain and devote the resources to it to do what you can. But the better thing to do would be to prevent it altogether or minimize it to the best that we can. And there's so much data that allows us to predict that's going to happen. So the question is, why aren't we actually proactively doing it versus waiting for someone to develop a chronic condition like a diabetes, like, congestive heart failure, COPD, what have you. And all of those things, there are several indicators that would tell us years in advance of those diseases actually happening. And this is where the prevention incentives aren't aligned. So let's say insurance company A realizes that, hey, if I spend $5,000 on this preventative thing today, then perhaps this patient would avoid getting, a chronic condition 10 years from now. But the issue is that that person may not be covered under that same insurance company for that long, length period of time. So therefore, what's the point of investing that 5,000, when there's no chance of seeing an ROI on that? So that's where I think we have to get together and say, what's the system-wide sort of mechanism by which we can align those incentives so that the technology then can say, hey, predict and prevent. So that ultimately those balloon costs that we see towards the, when one gets old and, one has, several conditions, that's where all the costs are going. And if there's a way to align incentives to fix that, that's where the potential is.
Well, I love your book, You and AI, and I think it should be required reading for directors to learn about exactly how they can make a difference in healthcare in their companies. And you've touched on a few points, and I'm seeing some questions in the chat that bring me back to Walter having raised the ethical issues. And I'll just start off by saying, I sometimes get a little bit queasy when I make healthcare claims about, well, geez, my employer is going to know about this. How do I feel about this? And whether it's about me or one of my family members. And I know from being in management that the types of claims I put through can impact the cost to the corporation. Maybe not individually, but in some cases, yes. How do you see the ethical issues, Walter? And give us a little bit of a tour of what those are. Both, it's between the employer and the employee, and then as between the employee and inevitably general AI, big brother, big sister. Who's eventually, as you put it, going to take over the world?
Yeah, well, first of all, there's a lot of, we have to realize that, so these models are filled with trillions of words. So if we blame the models, we blame the mirror, And so, because this is a mirror of who we are. And so luckily, in the Broca area of our brain, in the left hemisphere, language, the neural mechanics of language, there are three processors, like vocalization, verbalization, is the conversion. It's basically a compiler or probably an interpreter that converts your thoughts into words. 99.9% of the people have that. The second thing is subvocalization. It is when you read something, you also see the words in your mind or when you think about it. So 80% of the people have that. Now, the third thing is the inner monologue. The inner monologue, only 30 to 50% of the people have that. So recent Oxford University, up to 70% of the world do not have an inner monologue, or say that they don't have one, because they can confuse it with conscience or with a religious concept, or with an identity. Now, in LLMs, we call that the policy, or as Anthropic calls it, the constitution, or it's a programmatic barrier of what to do and what to do next, what to do not. So as humans, from Homo sapiens, 1,000 years, we have 100,000 years of experience with that tells us that saying stupid things does not add to our survival value. That voice in our head is continuously monitoring and telling us that is good, that is not good. It's also the guilt feeling of conscious, that the same thing we have put in these models. And we are getting better at it. Of course, the more you put rules in, the less creative they are, but also the less they hallucinate. So we are getting better at doing this. And I believe by our language is irreducibly complex, because of 100,000 years of living in the real world. You know, computers have only lived 50 years in a map of the world, not a territory. So it is our duty as humans to tell, you know, to teach these models also our humanity, you know, like, and I think at Stanford, we are working a lot of, on this. So, and, you know, the ethical part is also, if you wouldn't say something, then you can make models unlearn. It's a lot of trouble unlearning because it costs money, and, you know, but you can make it unlearn some things, you know, like, which is not good. But in the end, I think the problem will be solved by, and certainly in healthcare, with synthetic data. You know, like we are now, data is territorially watched in healthcare. You know, like this is my silo, I'm not giving it. And that's why most people will remain with their cloud provider, you know, like because their data is there. Now, if we have synthetic data that has, where we can extract the exact patterns of the data, plus we also, the statistical models of that data, we can enlarge, you know, like the data sets and get more precise models. The problem is that we are using, for the moment, we are using gradient descent. It's a neural model that does, you know, the easiest way to comprehend is it's a mosquito. A mosquito is a nose with a brain, you know, it doesn't see. So, but it works on, it finds you from, you know, 10 meters, it smells you, then it goes onto here, then it loses you, it goes back, and then it goes, you know, like it's trillions of neural weights. We as humans, we cannot check that. It will take a lifetime to check even one model. So we have to make models to actually monitor models, and models to monitor the models that are monitored, you know, and in order to, because it's very easy to say, people like, you know, oh, it's a black box. It's like, oh, we open the black box and then you see it. No,
I'm sorry we're out of time. You've just scratched the surface of those ethical issues, and I want to thank our panelists and hand it back to Patrick Houston to wrap us up. Patrick?
Thanks a lot, Louis. We can always count on you to end us on time.